Hi, I'm Dr. Zohaib Ahmed with the Advent Health Internal Medicine Residency Program. Today, I'm going to be presenting a rare case of primary cardiac lymphoma with right ventricular obstruction. Primary cardiac lymphoma is a rare disease. As of now, there is no consensus on the management of primary cardiac lymphoma. We report a case of primary cardiac lymphoma associated with a high risk of cardiovascular decompensation that responded well to chemotherapy. A 65-year-old female with a history of prior smoking and chronic obstructive pulmonary disease presented to our hospital complaining of worsening dyspnea and weight loss. A 10 by 5.5 centimeter intracardiac mass occupying almost entire right ventricular cavity was found. The mass was associated with high-grade right ventricular outflow tract obstruction and extensive invasion of right ventricular free wall and interventricular septum, causing severe right ventricular dysfunction. A percutaneous endomyocardial biopsy confirmed the diagnosis of germinal center B-cell diffuse large B-cell lymphoma without common cytogenetic abnormalities. Staging scans and bone marrow biopsy was negative for extracardiac disease. Due to extensive myocardial invasion, surgical intervention was not possible. The patient was started on R-CHOP chemotherapy. Restaging scans after third chemotherapy cycle demonstrated a complete metabolic response and a 50% improvement in right ventricular functional volume and ejection fraction. The patient was planned to complete a total of 6 cycles of chemotherapy. Large primary cardiac lymphoma causing high-grade right ventricular outflow tract obstruction carries worse prognosis, and early surgical debulking has shown to improve survival in such cases. However, as demonstrated in our case, timely chemotherapy can improve survival in such patients when surgical intervention is not possible due to extensive myocardial invasion.